Welcome back to another NCLEX pharmacology review. Today's focus is vasodilators. These are high-yield medications that will absolutely show up on your exam. So let's break them down clearly and quickly. What are vasodilators? Vasodilators relax and widen blood vessels. This lowers resistance, reduces blood pressure, and decreases the workload on the heart. They're used for hypertension, angina, and heart failure. Here's the question to keep in mind. Which patient would you hold this medication for? We'll answer that soon. Types of vasodilators. Direct-acting vasodilators include hydralazine and minoxidil. Nitrates like nitroglycerin reduce preload by dilating veins. Calcium channel blockers relax arteries. Examples are amlodipine and nicardipine. ACE inhibitors and ARBs reduce resistance through the renin system. And don't forget phosphodiesterase inhibitors like sildenafil. Now here's the catch. One of these drug classes has a deadly interaction. Which one is it? Stay tuned. Common uses. These medications treat high blood pressure, heart failure, angina, and hypertensive crisis. They're also used for pulmonary hypertension and Raynaud's disease. Think about this. If a patient has chest pain and extremely low blood pressure, what's your next step? Hold that thought. We'll test it in the practice questions. Side effects and nursing considerations. Hypotension is the number one risk. If systolic blood pressure is less than 90, you hold the drug. Headaches are common with nitrates. Hydralazine often causes reflex tachycardia. Minoxidil and calcium channel blockers may cause swelling and fluid retention. Nitroprusside carries the risk of cyanide toxicity. And never forget, nitrates plus sildenafil can kill. Quick check. Could you explain that deadly combination to your patient in one sentence? You should be able to by now. Safe vasodilator administration, the vascular mnemonic V, vital signs, hold if systolic is below 90. A, avoid sildenafil with nitrates. S, start slow, first dose seated or lying down. C, cyanide risk with nitroprusside. U, understand headaches are common. L, look for fluid retention. A, assess for reflex tachycardia. R, rise slowly to prevent orthostatic hypotension. Here's a challenge. Can you recite at least 3 letters from vascular without looking back? That's how you know you're locking it in. NCLEX practice questions. Question 1. Nitroglycerin is ordered. Which finding means you hold it? A, heart rate 72. B, blood pressure 88/50. C, mild headache. D, blood glucose 120. Answer, B, systolic below 90 is too low. If you miss this, imagine giving nitroglycerin to that patient. What would happen? Question 2. A patient on isosorbide mononitrate asks about sildenafil. Best response? A, yes, small doses are safe. B, no, it can dangerously lower blood pressure. C, only take it in the morning. D, check blood pressure first. Answer, B, never combine nitrates with sildenafil. This one is test favorite. Don't miss it. Question 3. A patient on nitroprusside develops confusion and metabolic acidosis. Next action. A, stop the infusion. B, give another dose. C, encourage fluids. D, check potassium. Answer, A, these are signs of cyanide toxicity. So, when you see confusion and acidosis together, stop and think toxicity. Question 4. Which vasodilator most often causes reflex tachycardia? A, hydralazine. B, amlodipine. C, nitroglycerin. D, losartan. Answer, A, hydralazine. Quick quiz for you. What's the fix for reflex tachycardia? Beta blockers. Question 5. A patient on amlodipine has new ankle swelling. What's the next action? A, reassure the patient. B, assess for worsening heart failure. C, stop the drug immediately. D, recommend low sodium. Answer, B, always check for heart failure when you see edema. Can you explain why calcium channel blockers cause fluid retention? If yes, you're ahead of the curve. Recap. NCLEX must know hold vasodilators if systolic is less than 90. Headaches with nitrates are expected. Hydralazine can trigger reflex tachycardia. Nitroprusside carries cyanide toxicity risk. Never mix nitrates with sildenafil. Watch for edema and fluid retention. If you can teach these 5 rules to a classmate, you've mastered vasodilators. If this video helped you, hit like, subscribe, and turn on notifications for more NCLEX reviews, and drop your next topic request in the comments.